Jamaica now has 143 confirmed cases of COVID-19. This follows 18 new additions over the last 24 hours. Of that number, 5 are males and 13 are females, ranging from 4 years old to 56 years old. So we have had 18 new additional cases since we announced the last time, over the last 24 hours. The 3 cases are contacts of a confirmed case. The other 15 are under investigation, and there is some suspicion that a number of them are linked to the call center in Portmore, but we are still investigating. 23 persons have recovered and been discharged, and 5 persons, unfortunately, have passed as a result of COVID-19. We have now tested some 1,424 samples, including the samples that were tested for severe acute respiratory infection. 143 of that number are confirmed positive, while 1,281 are confirmed negative cases. Of the 143 confirmed cases, to date, 52 are from Alorica, the call center in Portmore, St. Catherine. Just to say that the St. Catherine Health Department is actively following the situation at Alorica and are being provided with the additional support personnel to expedite their contact tracing efforts. In addition to the St. Catherine Health Department, the KSA, Kingston and St. Andrew Corporation area, and the Clarendon Health Department are also working to the extent that persons who work at Alorica are located in those parishes, and I'll give some more detail on that shortly. In terms of, well, maybe I should give the details now. Of the total number of staff on record at Alorica, numbering 787, based on the information we have, some 559 are from St. Catherine. We have made contact with 447. This is the health team. There are some challenges as it relates to 112 of those names because of addresses not being correct. We are continuing the efforts to locate those individuals. Their contacts, meaning the contacts of persons who work and who have been tested at Alorica, we have made contact with an additional 179 of their contacts in the parish. The testing continues. We have done 414 interviews and collected samples, and we have done this through the location at Alorica, the Linstead, St. Jago, Old Harbour, and Greater Portmore health centers, and that exercise continues. We will continue until we complete the process. We have had 11 persons from the entity out of Clarendon, and 10 of their contacts tested. So that means 21 persons have been tested in the parish of Clarendon, 1 positive so far. In the KSA area, on record, there are 125 that are now being sought. There are plans to do some tests today, I'm told, between up to 30 tests. There are some challenges as it relates to identifying and reaching some of these individuals. And the team on the ground in the 3 parishes are working and have been working very diligently in an attempt to reach the individuals and to interview them and to collect samples from them. So the work is ongoing. So we can say then that most of the persons who, of the 787 staff members, have been accounted for, but there are some numbers that we still need to work on because of address discrepancies, telephone discrepancies, and we're working with the management to sort those out. I want to just make an appeal to those persons who work with the company to call the Ministry of Health at 888-1-LOVE or 876-538-3149. That's 876-538-3149 or 876-538-2780. That's 876-538-2780. And we will make appropriate arrangements to reach to you and to collect samples. Alternatively, if you're able to get to one of these health centers, the Linstead, St. Jago, Old Harbour, Greater Portmore health centers, or to the Alorica complex in Portmore. Now, we know there's a curfew on, but we're going to make provisions for you to use your ID, your identification. If you have or still have your identification, to be able to reach to one of those locations for samples to be collected. Alternately, and perhaps more conveniently, if you call the number 888-1-LOVE and the other numbers that I've just outlined, 538-3149 or 538-2780, then we will make the appropriate arrangements to reach you. It's very important, given the extent to which we have had positive cases coming out of that call center. It's very important that we reach all employees and at least have an opportunity to interview them and certainly to collect samples from them. Our intention is to test everybody, and while we're making progress, we believe our progress will be greatly enhanced if we can get the outreach or the responses from persons who clearly know themselves, so that we, the health team, can do the necessary work to support the management of this particular crisis. The Alorica situation is the dominant challenge for us now in the country as it relates to COVID-19 and the response. It represents for us the weak link, if you will, in the arsenal and the work that we have been doing. It is going to be and is very difficult to reach all those individuals, but even more so to contact trace all the persons that they have come in contact with. And given the extent to which we have had positive tests, it is quite clear that the possibility or the likelihood of spread by one of those individuals to their friends, neighbors, the taxi driver, the restaurant, wherever they go, the possibility for spread are real, and it is something that we need to take very seriously. Hence, the measures that have been announced by the government, by the Prime Minister, are about St. Catherine. So the work continues on that, and again, we urge those persons who know themselves to make themselves available so that we can proceed to do what is needed as we attempt to control the potential threat that this situation provides for us. The challenge with Alorica brings into sharp focus the BPO space in general, and I know a lot has been said on this. The Prime Minister announced a series of measures yesterday in the Parliament. I just want to update the country from a public health standpoint where we are and what we have done to date as it relates to the BPO space island-wide. So there are 68 BPO facilities across the country. 62 inspections were done between March 14th and April 15th. 50 of that 62 passed the inspection in line with the existing Ministry of Health guidelines for workplaces, with particular focus on the COVID-19 risks. 12 did not meet the criteria and have been provided with work plans to address these issues. Even as we speak, the Ministry of Health continues to monitor and to enhance those guidelines in keeping with what was announced in the Parliament by the Honourable Prime Minister last evening. And we're working with the association to the extent that they have their members. They are also working with their members. To the extent that other operators are not members of the association, we're also providing or contacting and working with them in order for them to enhance the standards that are required. And as was said before, to the extent that those requirements are not met, then the government will take whatever action is necessary in the public health interests of the workers, but also more generally of the community and of the country. So it's important that the protocol be followed, and the government is doing what is necessary to ensure that that is the case. In terms of isolation and quarantining, 21 persons are in quarantine currently. 127 persons are in isolation. All persons in isolation remain stable, and there are no critically ill patients at this time. 15 patients are in our transition care facilities, and they remain stable and are awaiting discharge testing. And that would mean, of course, 2 negative tests over a 48-hour period. So, ladies and gentlemen, I want to use these comments as my opening remarks as it relates to the work of the Ministry of Health, in particular around the COVID-19 threat that we face. The 18 positive over the last 24 hours does indicate that the threat continues, the risk continues, and we're doing all that we can to mitigate and to control that particular risks. All right. If we can now, I wanted to have a brief conversation with Mr. C? Miss C, okay, who is a worker of a BPO space, and to get her opinion on what is transpiring within her entity and how they're observing the protocol that is established. Is she online? Okay, Miss. Hi, how are you?
I'm doing good, sir. How are you?
Fine, thank you. How long have you been working in a BPO facility?
I've actually been working here for 4 years.
Okay. And how has it been? How has the experience been?
My experience is, I can't even describe it, to be honest, because when I started working here, it was my first experience in a call center industry, to be honest. And it has been good because, of course, the level of growth that I've achieved in 4 years, it has been a journey because I started as an agent and I'm now a manager for my business unit. So, of course, we do promote growth here and we do try to take care of our employees as best as possible.
All right. Well, that's good to hear. So the COVID challenge which we're facing as a country clearly has put some additional measures on all of us as a society. And your particular work environment has been in the spotlight recently. Tell me what changes, if any, have been made in your entity that would represent a response to what we are now facing from COVID-19.
All right, so for my company, we have been placing a whole lot of things into context to ensure the safety of our staff. One of the main things that we implement here is our social distancing. That's one of the things that we started off with first. We tried to ensure that there was enough space on every single production floor between each employee. So we had to shuffle around everybody. So we know at least maybe 2 empty seats between each agent. And we have at least 400 people working from home at the moment, and we're looking to send more home. We're just trying to make the necessary arrangements to get that done. But our company has also we have more nurses on site now. We have our thermometers where we're checking temperatures at the gate, and we have our nurses checking every single production floor at different intervals throughout the day, just to see if our staff is okay, and see if anybody is experiencing any flu-like symptoms. If they are not doing so well, we send them home. Which most times all the time so far it has just turned out to be a common cold actually. So we're looking up on that as a plus side for our industry right now. One of the things that we have also done is we have encouraged our staff to ensure that they're wearing masks. Because from a company standpoint, we ordered our masks weeks ago, and we got confirmation that they'll be in office today, so we're set to do distribution as soon as possible. We've also installed our hand sanitizers in every single building in all our locations. And we've also had hand washing stations on the outside. So, of course, whether you're on your way to the cafeteria or even leaving or entering the premises, there's a hand wash station easily accessible where you can wash your hands with soap, of course, to, help combat this virus. So we are putting things in place to ensure that our staff is safe.
Okay, thank you very much. Do you get the feeling, and final question, that your staff and management are fully aware of the risks posed by COVID-19? Are people aware? Are there any? Are they just acting normally, casually, without the due consideration for this public health threat? What's your sense?
Actually, based on what I'm seeing, I believe people, from our call center, I believe people are taking it actually very serious. Because just yesterday I was in the cafeteria and I noticed a group of ladies sitting together, and then I heard one of them saying, "Oh gosh, guys, remember social distancing." And then they just dispersed, trying to separate from each other and avoiding close contact with each other. So I do think that our staff understands that, hey, if you don't follow the protocols that our company and the government on a whole are set in place, then, you risk yourself being infected and you risk passing that infection or that virus to everybody else that you come in contact with, not just at work, but on the street. So our staff is taking it serious because not just information that's coming from the government, but we try to share information with them every day via emails, via popping into departments, asking, "Hey guys, are you okay? This is what is going on right now. So remember to stay away from each other, remember to wash your hands." So I believe that the team is taking it seriously, and we're not just going about this nonchalantly. We are taking it seriously because everybody wants to stay safe. We want to get back to our regular life as soon as possible.
All right, so finally, you say you're a manager. I mean, I wasn't planning to ask you about your company, but would you like to name the company?
Of course, I have no issues naming my company. I'm a proud Isolite. I'm from ITL Smart Solutions, and we are definitely taking this serious. It's not a joke thing, and our CEO and his amazing team has definitely, they've stepped up to the plate, and they're, just putting things out there in place for our staff to be safe.
Okay, thank you very much. All the best to you, and please keep up the measures, the social distancing, the sanitizing, the mask wearing, all the critical things, the temperature checks that are required, and best regards to you and your entity.
Definitely. Thank you so much, Dr. Toftan.
So, ladies and gentlemen, we decided to do this not to give any sort of undue influence or to in support of any industry, certainly not the BPO industry or any other, but I wanted to give an opportunity to an entity that is complying with the measures to indicate to the populace and to all of us that it is possible for us to practice the social distancing, the sanitizing, the temperature checks, the measures that have been put into the protocol to allow industry to continue while still observing the public health risks that are there. And, it's important that we do this, meaning the BPO space, because frankly speaking, if we don't, then we're going to get into the issues that we now have to confront in St. Catherine. And to the extent that those issues are a problem, is to the extent to which the government will have to step in and take the appropriate measures, as we are doing in St. Catherine. So it's so important for us to understand that we can observe the protocol. It is possible. There are those who are, and I certainly would commend and recommend to all involved in the industry to follow suit. The public health team will be out. They'll be doing the inspections. They'll be stepping up the inspections to take the appropriate measures that are required in order to keep the community safe and to keep the workers in that space safe. All right, so I want to just close this briefing for now and open the floor for questions.
Thank you very much, Minister. We're going to invite our media partners, those who are on Zoom, to use the raise hand feature if you have a question for any member of the panel. All right, we have Brittany Clark, and we ask that each person identify themselves by name and entity. So we go to Brittany.
Good morning, everyone. Brittany Clark, Nationwide News. My questions are given the news that the South Camp Road, the Sutherland Group Bus Services facility has now closed down as a result of some speculation that there might be a possible case of COVID-19 at that facility. Has the ministry now started doing contact tracing and testing of the workers from that location? And have they identified any other linkages to other BPO sectors? And considering the rumors that persons have left St. Catherine and are now occupying spaces in other parishes, has the ministry, or can the ministry say whether or not they've actually located persons who are from St. Catherine in other parishes, and will they face charges for breaching the lockdown protocol?
Okay, did you say that there's a you're talking about the BPO center that closed down recently, not Alorica, the other one? Sutherland, right. Yes, we are aware of the decision by management to close out of an abundance of caution. And frankly speaking, we think that's a responsible thing to do. And from the public health perspective, the team has been alerted, and the team are doing an assessment to determine what course of action to take. Remember now, this closure is just being cautious. So the assessment would bear that in mind and would be happy for that precautionary measure and would do whatever follow-up is required to ensure that we do not err on this and create a scenario that now exists in Portmore.
And regarding the persons who are said to be leaving St. Catherine to end up in other parishes, have the ministry actually recovered any of these persons?
Well, as I said earlier, the contact tracing that is now taking place around persons who are on record at the entity is in full swing. A number of persons have been contacted. We do have some issues with incorrect addresses. Persons can't be located, which is why we're making the appeal for persons to make contact. We have a few other measures that we are taking, which I'm not going to speak publicly to reaching some of these individuals. The extent to which persons may move from one place to the next will become more apparent as we continue to contact trace. And that contact trace is an investigation. So you go into a community, someone lives at a particular location, everybody knows that they live there, but they're not there, then you will have a better sense that they may have left because they don't want to be identified. For the most part, I think persons are cooperative, so I don't think it's going to be a major issue as it relates to those employees. Persons are willing to give the samples and be tested. There is a percentage that are not as willing, but I don't see it as a major problem at this point in time. Closer to the time, over the next couple of days, we'll have a better sense, and then we'll take a decision as it relates to how we proceed from there. Thank you.
Thanks, Minister. We're going to go now to Damon Mitchell.
This issue that was raised at the last press conference. The mic was muted, and as a consequence, I could not have given the follow-up to the CMO. I was really trying to get to the issue as to the policy for handling bodies of deceased coronavirus patients. So for example, CMO, is there now a policy or being considered for disposal by cremation or burial?
Our policy has been sent out. It has been out from the 14th of March, I believe. And the policy does indicate that burial may be either by cremation or disposal, may be either by cremation or burial. We
And
do
is there a
not
time frame?
specify. Pardon?
I was asking, is there a time frame within which this burial or disposal must happen?
No, there is no time frame.
One of the concerns of the industry is that several of the operators in the funeral business are not registered, which raises concern in respect of hygiene practices. Is this not a bother for the health ministry?
Of course, certainly wherever there is non-adherence to infection prevention and control measures, that is a major source of concern. We do recognize that when we have had 2 meetings so far, and I've encouraged the team to have more meetings. If you are speaking about persons that are not registered, then it may be that those persons are not showing up at these meetings.
Exactly.
The protocols have been widely distributed, and I think based on this information that you are indicating now, I will indicate to the team that where we have knowledge of persons that are informal, then we need to also try to visit those areas to ensure that the measures are being put in place. Because the protocol has been circulated and it does go through in detail how it is that the bodies are to be treated at each stage of the process from death to disposal. So it is very clear and it does require that persons adhere to the measures. These measures, I do want to emphasize, are measures that are in keeping with normal infection prevention and control measures that we have been insisting on in the treatment of bodies.
Permit me, if you will, CMO, to go back to the issue of Alorica. Was there a recommendation at any time by the local health authority in St. Catherine for the closure because it was not following the required guidelines?
No, there was not.
So does that then mean that there would have been some dereliction of duty if the local health authority in St. Catherine did not observe that there were breaches and take some action to fix it?
Well, we have to be careful how it is that we say the infection has spread. Okay, so the case investigation goes on, and we are yet to determine how it is that the infection had spread among the employees. Now, in terms of the audit tool that was in place, the audit tool that was carried out indicates that what measures were there were in fact adhered to. In addition to that, the ministry had put out a workplace policy with regards to COVID. And we have also looked at that, and the indications that we are seeing from the reports of the investigations of these BPOs is that there was compliance. Now, further to that, we have recognized that there are more stringent measures that need to be put in place. Now, we are trying to finalize this new document. We have reviewed the document that has been put out by the association, and it is a detailed document that we are adopting some of those measures that were not in our previous policy document. So more stringent measures are going to be put in place for the BPOs to adhere to. However, at the time of assessment, the document that was in place showed that there was adherence to those measures.
Thank you, CMO. We're going to go now to Zara.
Hello, you guys can hear me?
Yes, go ahead, please.
Okay. All right, good morning. I wanted to know, the minister had mentioned several weeks ago that right now we were using less than 20% of our testing capacity. And the hope was that we'd ramp up to 380 samples per 8-hour day. I know that you also said, Minister, that you intended to test everybody over at Alorica eventually. I just wanted to get a sense of not just Alorica, but even this Sutherland Global. Where are you in terms of ramping up testing to get to that point of 380 per day?
In terms of getting to 380 per day, we are moving towards that actively, and by Monday, we will be at that type of capacity. This is because we will be introducing the use of the National Public Health Lab, testing facilities at the National Public Health Lab. And we will now have, as of Friday, we will have 2 facilities that are testing. So this will give us the capacity to test. And we try to keep the capacity above what we expect that is going to be the demand for testing.
Thank you very much, CMO. We're going to go to Kate Chappell. Kate, go ahead, please.
Yes, you hear me?
Yes, we are. Go ahead.
Yes. Good morning. I'm wondering, the minister had mentioned that some tests were blocked by the U.S. I'm wondering how many tests were blocked and what was the reason given, and where are the alternatives coming from that he had mentioned?
Okay. So, yes, in the parliamentary session last evening, the question was asked, and I responded that we have had some difficulties with materials coming in for the COVID response. And this is as a result of the correspondence that we have had from our suppliers. So we have suppliers that we deal with, that we purchase routinely from. Of course, with this particular scenario, we have had to ratchet up the request for supplies. And in 3 or 4 cases, the correspondence that we have received from those suppliers have been that stocks have been delayed, or in some instances, the wording is more significant, blocked by the new measures that have been put in place. Now, I know that the Ministry of Foreign Affairs and Foreign Trade has been working, Minister Johnson Smith, to try and assist in some of these cases. And we have had some successes in the cases that I know she has worked on, and her team, she and her team. But nevertheless, it has caused delays in a number of cases, and there are still pending cases where we still have not gotten some of the supplies that we would like to get. The alternatives vary. I mean, in some instances, we get from suppliers from other countries. In some instances, it's routed through the U.S. or through third countries. I don't have all the details, but we have attempted to leverage our relationships that we have had over many years in procuring medical supplies, with the NHF being the key coordinator of that, the National Health Fund, that is. And as a consequence, have been able to address some of the issues. So what I'm prepared to say is that it has definitely caused delays based on what the suppliers have said to us. And in some instances, we have been able to maneuver and gotten some of those supplies, but there are still supplies that are pending as a result of those issues.
Thanks much, Minister. We're going to go now to Jamaica Social.
Hi, good morning, everyone. I'm Cassius Watson from Jamaica Social. Minister, yourself and the Prime Minister have literally elevated the term or the phrase Tanaya Yard. But I want your reaction now as to the reality of what happened when the lockdown was announced for St. Catherine, where many people during the course of the press conference, when they heard that the parish would have been locked down for 14 days, for 7 days, literally fled Portmore and other areas into, into other parishes, many into Kingston, jamming the highways and all. Your thoughts on hundreds or thousands of Portmorians, people from St. Catherine, flooding into Kingston, and some of whom may have come in contact with people who have this virus. Your thoughts on how that impacts you overall, and your personal thoughts on how Jamaicans are reacting to this crisis.
Right. So the 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 announcement was made less than 2 hours before the curfew, which was in effect, a curfew that was from 9 to 5 a.m. The announcement was made maybe around 7 or approximately thereabouts. And so the period between the announcement and the curfew would have been fairly limited. I've heard stories of persons moving out, and I've seen some pictures on social media. I'm assuming that they're accurate, which suggests that some persons may have opted to move to other jurisdictions to avoid the lockdown. That's a risk that we take. I mean, the appeal to citizens hopefully would have justified them staying put for their own interests, health interests, and the interests of the health interests of the community. To the extent that some may have left, it would mean that they would pose a risk to wherever they go. And we would certainly want to appeal to those individuals and whomever is hosting them to still recognize that that risk could be their own risk, and therefore they should, if the need arises, call our 888 number and make themselves available for us to do whatever testing that may be required, particularly if they are associated with the particular BPO firm that is now under investigation and where the contact tracing is focused, or linked to someone who worked at that BPO space. So the short answer to your question is, sir, I am not fully clear that there was a mass exodus as is being projected, given the time period between the announcement and the curfew. But I do accept that there would be sufficient time for some, if they so desired, to leave. And to the extent that those would have left, they would represent a risk. And what we need to do is to appeal to them to, particularly if they are linked to the Alorica entity, either directly or indirectly, to call the 888 number so we can take whatever measures are necessary to ensure that they are safe, and by extension, the community that they interact with is safe. Thank you.
Thank you very much, Minister. We also ask our colleagues on social media to ask questions as well. This question says, can you explain the difference between community spread and a local transmission?
The classification of the transmission has changed since the beginning of the outbreak. And so at present, we are using the classification where you have 4 different categories. You have no cases, and then you have imported cases, or rather, no cases, then sporadic cases, then cluster of cases, and then community transmission. With no cases is pretty clear. Sporadic cases are where you will find that you will have 1 or 2 cases that you are identifying that in our situation where many of those were imported cases. But also if in a country where you may have had 1 or 2 cases that you would not have necessarily identified that it was an imported case, it would have still have been considered as sporadic cases because there were few cases that are located within the country. The next step is when you have cluster of cases. Cluster of cases now mean that you have been able to link these cases a group of cases to one individual that may have been a confirmed cases. And we have seen in Jamaica where we have had several clusters of cases. Now, the situation where cluster of cases are concerned is that you can have local transmission, but it still remains a cluster of cases. So you may have had one person that you may have not been able to identify that it was an imported case or there was a link to an imported person. And from that person, you would have had other persons that would have been infected by them. It still remains a cluster of case, but it would still be considered that it is a local transmission. Community transmission now means that there is a significant, and there are now three different explanations from where you can have community transmission. One, where you may have a number of cases that you cannot identify any link to any imported case, any link to any confirmed case, and you have a number of these. Two, where you have a number of cases that you are now identifying through routine surveillance. And we have explained on several occasions that a big part of our surveillance is a network across the entire country where we take samples from persons that are presenting to our health centers and to our hospitals who have absolutely no link with a confirmed case or with any travel history. This provides a network across the entire country where we're testing so that we can pick up if there are any cases that do not have these links. Now, if we are getting that we have a number of those kind of cases, then that would be also significant for community transmission. Where the third category is where we have a number of clusters that there is no link. There is no link to either any kind of imported case or that there is any confirmed case that we had identified a cluster. So there is no link to an imported case, and you have several of these clusters across the country. So that would now be the third category where we would have community transmission. Now, based on what is happening, previous to what happened at Alorica, you would have noticed that we had several clusters. I think we had, I can't recall the number offhand, but we had several clusters, but it was just very few that were not linked to an imported case. Now, what we have now with Alorica is a cluster all of itself. It's a cluster that is coming out of a workplace related transmission. And that now would be identified as one large cluster. Now, for that cluster so far, we have not identified the link to an imported case, but the investigation is ongoing. So at the present time, we are still in the situation where it is that we have clusters of cases, and that is where we are still classified as cluster of cases. You know, I would take you to the comparison with, say, for example, China, where is still classified as cluster of cases, but there have been large numbers of persons in clusters. So there have been a large numbers of clusters, but large numbers of persons within clusters. So despite the fact that what we have in coming out of Alorica is that we have several persons, still remains one cluster. Our main aim at this time is to prevent any of those persons within this cluster to start developing their own cluster of cases and to start developing now that we would have any kind of community outbreak. And, this is why the measures that we have put in place and that we are asking persons to stay at home. Stay at home. The virus is not really in a place, the virus is in a person. And so if you move and you have the virus, you're taking the virus with you. And so it is important that the same prevention and control measures for infection that you wherever you are, you maintain those. And those are to stay at home, to pay attention to hand hygiene, hand washing, to ensure that you have you carry out respiratory etiquette to cover the cough and sneezes. All of those items still need to be in place wherever you are. It is not that a place, the virus is in one place. You take the virus with you, and so you have to take the necessary prevention measures.
Thank you very much, CMO. We're going to go to 2 quick follow-ups as we bring this digital press conference to a close. We're going to go to Kate Chappell.
Yes, Minister, were you speaking generally about PPE healthcare equipment, or were you speaking just about test kits? And how many were actually blocked?
Okay, as I said earlier, the details I don't have in front of me, but I know it involved personal protective equipment, N95 masks in one instance, and also some of the what do you call them, chemicals, reagents for testing. I recall seeing correspondence that speaks specifically to those 2 items. As I've said before, I know that the Ministry of Foreign Affairs and Foreign Trade are working with the U.S. authorities to address the issue, and it is my hope that we can sort it out. I believe we have sorted out some issues before, so it's hopefully will be sorted out. But nevertheless, it is a fact that delays have been caused by the current scenario, and it has affected our capacity to be fully ready for these challenging times. And so when asked in the Parliament, I was being sincere about what the state of play is, even while I recognize that we will attempt to find a way around the challenges that we face.
Thank you, Minister. I go to Zara.
Okay, I have several questions, Minister. You mentioned a while ago that
Zara,
12 of the BPOs...
I have a parliamentary committee meeting that is going to begin on Zoom, which I invite you to observe, on a special select committee on COVID, and it should have started already. So just give me one, please, or your top 2.
Okay, the top 2 are the 12 you mentioned that did not meet the criteria of the inspections that were carried out between March and April for the BPOs. Was Sutherland Global one of the 12? Was Alorica one of the 12? And who are the 12? That's one question. The second question is, the BPO sector has been criticized as being, let us say, one of the places where that presents a threat to the nation. Can you articulate for me why not have the BPO sector, all the employees, work from home? I was speaking to an Alorica employee yesterday who said she had gone from working inside to now working from home. Why is it that this cannot be mandated across the sector?
Let me give you the last one, and then I don't know if Dr. Spence has information on the first question, but it is a fact that up to 10,000 of the 40,000 or so BPO workers work from home, and that's a very positive thing. And my understanding is that more are attempting to do the same, to organize for that to take place. Having spoken to a couple of the players in the sector, I'm told, however, that in some instances, clients do not want to take that decision because of the confidentiality concerns around the information or the data that has to be dealt with, because apparently there's an infrastructure that is required, taking home the computer, for example, or the laptop, access to the data, in your own private space as opposed to having it in a controlled setting. And there are some concerns about that because of the confidentiality issues of the data and the risks of data going into the wrong hands. So I think that may be a key hurdle, but nevertheless, I know there are efforts to try and have more work from home, which I think is a fabulous idea and would certainly be one of the measures to maintain the social distancing in this case while continuing the industry. Dr. Spence, you have any comments on the...
Thank you, Minister. We do not have at this time the detailed inspection reports for all parishes in terms of all the entities inspected. We have a summary report. And so what has been indicated, if I may share, is that, for example, in St. James, there were 2 that did not meet the standard. And when we say not meeting this standard, while the general building and infrastructure was okay, it was in terms of, in particular for the COVID-19 circumstances, the not observing of social distancing, and in terms of the type of chemicals they would have been using for sanitization and disinfection, which would have been corrected for some of them already. And so I can't give the detail in terms of whether or not Sutherland, I think, was the BPO you mentioned, in terms of whether or not that one was found not meeting the standard. I don't have the list of the 12 that would have not met the standard just yet. I do know that Alorica in St. Catherine, however, based on the inspection report received, did meet the standard at the time that it was inspected.
Thank you very much, Dr. Spence. We go to Dashan quickly.
Good morning, Minister. Just quickly, just to ask you, has any employee of the JUTC tested positive for the COVID? And I ask you that because some workers from the company have been calling and saying they've been tested positive. I spoke with the managing director yesterday on the matter, and after first denying it, when I gave him some details on the case, then he told me to contact the Ministry of Health to get any information I need on the matter. So I'm asking you.
We would have tested several persons, and we would have done contact tracing for several persons who would have gone into home contacts. Now, in terms of having the details of where those persons work and to be able to publish that, we would not be able to do that. Though we can say that the contact tracing takes us into businesses. Wherever the contact tracing takes us, we go to find the persons that are affected, and the necessary precautions and information would be given to the employers so that they would be aware of the situation. So I cannot comment directly on a worker from JUTC, but I'm going to say it's not impossible that could have happened, because we have really contacted quite a number of persons, and we've had quite a number of positive tests.
Thank you very much, CMO, and we thank all our media colleagues for joining us. I invite our minister to give his closing remarks.
Okay, thank you very much, Stephen. Ladies and gentlemen, I want to thank you for another opportunity to speak on our COVID-19 response from the public health perspective. As you know, the government of Jamaica has kept or sought to keep the public as informed as possible around what is happening. The Honorable Prime Minister, he leads the charge, and the Cabinet in support of the best measures that we think, based on the clinical and technical advice, is for the country, given all the circumstances that we have, and the need for certain actions to be taken, including the restrictions. We will continue to do that. In the Ministry of Health, we have a briefing once, maybe twice a week, depending on the need so to do. And for the other days, we put out a daily press brief on the current status of our response to COVID-19. This, again, is all in the interest of being transparent, being accountable, and soliciting the support of the public as we seek to confront this and overcome this public health challenge. I want to invite those who may be interested. We're moving from here into the Special Select Committee of Parliament, which will be carried via Zoom, conducted via Zoom, and we're going to move right into that. And for those who may be interested, the meeting ID is 4189470068, and then you enter 031125. And the meeting, of course, is a discussion involving government and opposition members around the current state of the response. And I'm hoping today that we will speak on testing, among other things. And I know that there are some persons who have an interest in testing, the extent to which we're testing, the approach to testing. And it's important, I think, that we discuss and explain exactly why we're doing what we're doing and what is to come. So thank you very much. And for those who want to continue listening on, then we can go to that address for the Zoom meeting. Beyond that, we will continue to keep you updated. Thank you. Coronavirus is in Jamaica, and I know you feel scared.